Good day, sir. I am JD Malyari, your nurse for today. May I know your name and your date of birth?
My name is Yuan Han, born in April 1, 1998.
Explain the procedure to the patient. Position the client appropriately. Ensure patient privacy. Instruct patient to drape himself appropriately. Make sure environment is with adequate light and room temperature regulated.
Before we start, we will going to do proper hand hygiene. And then wear our clean gloves. We will now inspect our patient's head.
Inspect the person's head for size and shape. Palpate temporal area.
To proceed with, we will going to inspect our patient's face structure. Inspect the face, noting the facial expression and its appropriateness to behavior or reported mood. And then, although the shape of facial structures may vary somewhat depending on ancestry or features.
Eyes. Observe person's ability to move around the room and note facial expression. Inspection of external ocular structures. Inspect eyebrows for symmetry and movement. Inspect the eyelids and lid margins for swelling, discharge color, scaling, and erythema. Inspect eyelashes for hair distribution along the lid margins. Inspect eyeballs for alignment. Test eyeball movement. Inspect conjunctiva and sclera for color. Inspect lacrimal apparatus for swelling and tenderness. Inspect anterior eyeball structures. Inspect cornea and lens for smoothness and clarity. Test for corneal reflex. Inspect iris and pupil for size, shape, and equality. Test the pupillary light reflex. Test for accommodation. Test central visual acuity. Test visual fields. Inspect size and shape, skin condition, tenderness. Inspect external auditory meatus for swelling, redness, or discharge. Inspect external canal for redness and swelling, lesions, foreign bodies, or discharge.
I will stand arm length behind my patient, and then I will instruct my patient to close his tragus. Sir, can you please close your tragus? And then repeat what I will going to say, okay?
8,
6,
6,
8,
8, 8.
Palpate auricle for pain sensation on movement. Palpate mastoid area behind ear for tenderness. The nose. Inspect external nose for deformity, asymmetry, inflammation, or presence of skin lesions. Test the patency of the nostrils. Test olfactory nerve. Inspect the nasal mucosa for color, swelling, discharge, bleeding, or foreign body. Inspect the nasal septum for deviation, perforation, or bleeding. Palpate the sinus area. The mouth. Inspect the lips for color, moisture, cracking, or lesions. Inspect teeth and gums. Inspect the tongue and check for color, surface characteristics, and moisture. Inspect the buccal mucosa for color, nodules, or lesions. Inspect palate for color and mobility. Inspect the throat and note for shape, surface, characteristics of tonsils behind the anterior tonsillar pillar. The neck. Inspect the neck for symmetry and range of motion in active motion. Test muscle strength. Inspect thyroid gland for size and visible mass. Inspect external jugular vein. Palpate lymph nodes. Palpate thyroid gland. Palpate trachea for tracheal shift.
After all the physical examination, we will going to document all the findings.